Hi everyone, this is Hillary from the Nurse Preceptor channel on YouTube. I did my last video as a product review of the AccuMed Pulse Oximeter that I got on Amazon, and today I'm going to follow up with a video on how to use this device. Hopefully a lot of you who are medical professionals know how to use this already, and most of you who have been to a doctor's office anytime in the last few years know that this is a fairly common thing that people do in the office, in the hospital, and sometimes at home. I think that you really should have a pulse oximeter, especially one of these really small, relatively inexpensive ones that you can have in your emergency medical kit for when you're out and about. These are especially helpful if you have someone in your realm of influence who either has acute lung disease, if you have somebody who's prone to asthma flares, or if you have someone in your family or in your friend group who has chronic lung disease, because this is a good way of not only getting a snapshot of how they're doing right that second, but also a very good way of tracking the trends in how their pulse oximetry readings are. So what a pulse oximeter does, when you turn this device, well, first of all, it opens like this, and you slide a finger or a toe. Fingers tend to pick up a little bit better. Put your finger in this, and when you turn it on, there's a red light on the inside that lights up, and there's a sensor on the opposite side of it that detects how much of your hemoglobin is saturated by oxygen. So it tells you your oxygen carrying, not really your oxygen carrying capability, but how well you're actually oxygenating. If you can see this, it gives you a real-time readout of your pulse rate, which is your heart rate, as well as your pulse oximetry reading. If you can see this waveform at the bottom, if you were to feel your pulse and check to see if it's matching up with what's on the screen, you should be feeling a pulse beat every time you see one of those little waveforms, and every time you see this little blip that goes up and down. All right, so it's a good way to track the pulse rate as well as the oxygen rate. You can use this for a very quick snapshot, or if you're concerned about someone who seems to be deteriorating or having some difficulty breathing, you can leave it on and continue to monitor their progress. And this is especially helpful if you have someone who's doing some deep breathing exercises, who's coughing a lot, or who's on a nebulizer or an inhaler treatment. Again, I purchased this off of Amazon. I've got a link to it on my last video. I'll put a link to this as well. This device runs on two AAA batteries, so I would go ahead and keep some of those in your kit as well. Let's talk about a couple things. Troubleshooting this device. If you have the finger in it, you turn it on and you're not getting a good readout. If their hands are really cold, it's not going to give you a good reading. So you'll want to wrap their hands in a warm blanket or get them in a warm room. Try to get their fingers to perfuse a little bit more blood first. The other thing is that if someone's wearing really dark nail polish, it's not going to pick up well. And I'm not sure if it picks up through acrylics or not. So you would want to consider maybe either taking off the nail polish or trying a toe. If you're not getting a good reading on one finger, just put it on a different finger or try the thumb. That sometimes helps. The other thing is try changing the batteries if you're not getting a good reading. Make sure that these sensors that are on the inside are cleaned off really well. I am very happy with this device. I've used it a few times when I've exercised just out of curiosity to see what my pulse is and my saturation. And I find it to be extremely helpful. You should have one of these in your emergency medical kit. It's just as important as having a thermometer. Like the channel, subscribe if you haven't already, and we will have some more videos shortly. Thanks. Bye.